More than 4.9 million people in the UK have diabetes, though many cases of type 2 diabetes could be prevented or delayed by healthy eating and being more active, according to Diabetes UK. If you have diabetes, your body is unable to break down glucose into energy. This is because there is either not enough insulin to move the glucose, or the insulin produced does not work properly. There are a number of foods you should include in your diet every day. The NHS spends at least £10 billion a year on diabetes, which is about 10% of its entire budget, according to Diabetes UK. The charity says there is no specific diet for diabetes, though the foods you eat can help you manage your diabetes. A healthy diet is all about variety and choosing different foods from each of the main food groups every day, it explains. This means that people need to eat starchy foods, though you should avoid starchy foods that have a high glycemic index, which can raise blood glucose levels quickly. Diabetes type 2, the cheap snack that causes blood sugar levels to plummet within minutes. Diabetes UK says you should eat starchy foods that affect blood glucose levels more slowly and have a low glycemic index. These include foods such as whole grain bread, whole wheat pasta and basmati, brown or wild rice. It adds you should try to have some starchy foods every day. Indeed, there are a number of ways that you can help manage type 2 diabetes through healthy eating, regular exercise and achieving a healthy body weight. High cholesterol, 3 everyday foods which lower levels to reduce heart disease risk, advice how to live longer, the tasty snack that can starve cancer and reduce risk, insight Pfizer booster shot, the unexpected side effect after third dose. Pfizer finding, insight, there are no lifestyle changes you can make to lower your risk of type 1 diabetes. You should go for a regular diabetes checkup once a year to check your blood pressure and cholesterol. The NHS says that many people have type 2 diabetes for years without realizing because the early symptoms tend to be general. The health body adds that type 2 diabetes is far more common than type 1 in the UK, with around 90% of all adults with diabetes having type 2. Physical exercise helps lower your blood sugar level. You should aim for 2.5 hours of activity a week, according to the NHS. Diabetes UK says, being physically active is good for diabetes. Whether you feel able to go for a run or a swim, or can manage some arm stretches or on-the-spot walking while the kettle boils, it all makes a difference. Moving more can help the body use insulin better by increasing insulin sensitivity. Moreover, it can help you look after your blood pressure, because high blood pressure means you're more at risk of diabetes complications. Diabetes cases are set to rise to 5 million by 2025, according to Diabetes UK. The number of diabetes patients has more than doubled since 1996. The Mayo Clinic says, diabetes symptoms vary depending on how much your blood sugar is elevated. Some people, especially those with prediabetes or type 2 diabetes, may sometimes not experience symptoms. Symptoms include increased thirst, frequent urination, and frequent infections, such as gums or skin infections and vaginal infections.